Esomeprazole is a proton pump inhibitor, PPI, used to reduce stomach acid production. The MUPS, modified release tablet, preparation of esomeprazole provides a controlled release of the drug over time, enhancing its effectiveness and allowing for once-daily dosing. It is commonly used to treat conditions related to excessive stomach acid, such as gastroesophageal reflux disease, GERD, and peptic ulcers. Uses. Proxium is primarily used for gastroesophageal reflux disease, GERD, peptic ulcers, Helicobacter pylori eradication, in combination with antibiotics. Prevention of gastric ulcers associated with non-steroidal anti-inflammatory drug, NSAID, use. Zollinger-Ellison syndrome. Mechanism of action. Esomeprazole works by inhibiting the proton pump in the stomach lining's parietal cells. The proton pump is responsible for secreting hydrogen ions into the gastric lumen, which are the final step in acid production. By blocking this pump, esomeprazole effectively reduces the amount of stomach acid produced, thereby alleviating symptoms associated with excessive acid secretion and allowing healing of acid-related damage. How long does it take to work? Esomeprazole typically starts to work within 1 to 2 hours of administration, with peak effects usually observed within 4 days of daily dosing. The full therapeutic benefit, such as relief from GERD symptoms, may take 1 to 2 weeks of continuous use to achieve maximum effectiveness. Absorption. Esomeprazole is well absorbed after oral administration, with peak plasma concentrations reached within 1 to 2 hours. The MUPS formulation allows for a gradual release of the drug, maintaining effective plasma levels over a longer period compared to immediate release formulations. Route of elimination. Esomeprazole is primarily metabolized in the liver by cytochrome P450 enzymes, mainly CYP2C19. The drug and its metabolites are then excreted in the urine, with a small portion eliminated in the feces. Dosage. Typical dosages of Proxium are as follows. GERD, 20 mg to 40 mg once daily for 4 to 8 weeks, depending on the severity and response to treatment. Peptic ulcers, 40 mg once daily for 4 to 8 weeks. Helicobacter pylori eradication, 20 mg to 40 mg once daily in combination with appropriate antibiotics, for 10 to 14 days. NSAID-induced ulcer prevention, 20 mg to 40 mg once daily, depending on individual risk factors. Zollinger-Ellison syndrome, 40 mg twice daily or as directed by a healthcare provider based on individual needs. Dosage adjustments may be required based on the patient's response and tolerability. Administration. Proxium should be taken orally, swallowed whole with a glass of water. The tablets should not be chewed, crushed, or broken to ensure proper release and absorption. It can be taken with or without food, but it is typically recommended to take it at the same time each day for consistent results. Side effects. Common side effects include headache, diarrhea, nausea, abdominal pain, flatulence. Serious side effects are less common but may include allergic reactions, e.g., rash, itching, swelling. Severe stomach pain. Signs of liver dysfunction, e.g., jaundice. Severe kidney issues. If any severe or persistent side effects occur, medical attention should be sought immediately. Toxicity. Overdose of esomeprazole may lead to symptoms such as nausea, vomiting, abdominal pain, and diarrhea. In severe cases, it could result in confusion or dizziness. Treatment typically involves symptomatic care and supportive measures. Activated charcoal may be used if the overdose is recent. Precautions. Precautions should be taken in patients with severe liver impairment, renal impairment, history of gastric malignancy. Long-term use should be monitored. Bone fractures. PPI use has been associated with an increased risk of fractures. Interaction. Drug interactions. Esomeprazole may interact with certain drugs, including clopidogrel, may reduce its effectiveness. Warfarin, increased risk of bleeding. Ketoconazole or itraconazole, may decrease their absorption. Diazepam, may increase plasma concentrations of the drug. Always inform your healthcare provider of all medications you are taking to avoid potential interactions. Food interactions. Food does not significantly affect the absorption of esomeprazole. However, it is advisable to avoid alcohol and caffeine, which can exacerbate acid-related symptoms and may counteract the benefits of the medication. Disease interactions. Patients with liver disease should use esomeprazole with caution and may require dose adjustments. Long-term use should be monitored to avoid potential complications. Pregnancy use. Esomeprazole is categorized as a Category C drug during pregnancy, meaning that risk to the fetus cannot be ruled out. It should only be used during pregnancy if the potential benefits outweigh the risks and under the guidance of a healthcare provider. Lactation use. Esomeprazole is excreted in breast milk in small amounts. While it is generally considered safe during lactation, it should be used only if clearly needed and under the supervision of a healthcare provider. Alternative medications or breastfeeding modifications may be considered if necessary. Acute overdose. In the case of acute overdose, symptoms may include nausea, vomiting, and abdominal pain. Treatment involves symptomatic management and supportive care. Activated charcoal may be administered if the overdose is recent. Contraindication. Esomeprazole is contraindicated in patients with hypersensitivity to esomeprazole or any of its components. Severe liver disease, adjustments may be needed. Use direction. Proxium should be taken as directed by a healthcare provider. It is important to follow the prescribed dosage and avoid altering the form of the tablet. Regular monitoring and follow-up are advised to assess the efficacy and adjust the treatment if needed. Storage conditions. Store esomeprazole tablets at room temperature, 15 degrees Celsius to 30 degrees Celsius, away from light and moisture. Keep the medication in its original container and out of reach of children. Volume of distribution. The volume of distribution of esomeprazole is approximately 16 L, indicating moderate tissue distribution, with significant accumulation in the gastric mucosa. Half-life. The plasma half-life of esomeprazole is approximately 1 to 1.5 hours. However, the clinical effects persist longer due to the inhibition of acid secretion, which can last for up to 24 hours. Clearance. Esomeprazole is primarily cleared through hepatic metabolism, with approximately 80% of the drug excreted in the urine as metabolites. The clearance rate can be affected by liver function and other factors, requiring dose adjustments in some cases.